Millions of seniors pop these three nutrients every morning from brands you see at Costco and CVS, thinking they're doing their bones and heart a favor. But there's something the supplement companies aren't telling you about magnesium glycinate, vitamin D3, and K2 that could put your health at serious risk and cause hypermagnesemia or dangerous INR drops. If you're over 60 and taking this popular trio, you need to hear these 5 warnings before you take your next dose. What I'm about to share isn't meant to scare you away from beneficial nutrients. It's about making sure you're taking them the right way, because the research shows this combination can help you tremendously when done correctly, but cause real harm when done wrong. And here's the problem. Most people over 60 are doing it wrong. The drug interaction databases reveal something that catches most doctors off guard. There's a documented moderate interaction between vitamin D3 and magnesium glycinate. When you combine these two, your magnesium blood levels can climb above 2.6 mg/dL, the dangerous threshold, especially if your kidneys aren't working perfectly. Here's what makes this scary for seniors. After 60, almost everyone's glomerular filtration rate slows down. It's completely normal aging, but it means your body can't flush out excess magnesium like it used to. The early warning signs aren't dramatic either. You might feel queasy, dizzy, or unusually tired. Your muscles could feel weak, or your deep tendon reflexes might seem sluggish. Most people brush these off as getting older. But when magnesium keeps building up above 2.6 mg/dL, you could experience flushing, confusion, dangerously low blood pressure, slow heart rate, and trouble breathing. In extreme cases, this becomes life-threatening. Doctors call it hypermagnesemia, and it happens to older adults taking this combination far more often than anyone admits. Now, if you're on blood thinners like warfarin or Coumadin, the vitamin K2 part of this combination could literally save your life or end it, depending on how you handle it. This is where things get really serious, and honestly, it's shocking how little patients learn about this interaction. Vitamin K2 helps your blood clot properly. Blood thinners like warfarin work by blocking vitamin K's clotting action. When you add vitamin K2 supplements, you're basically fighting against your blood thinner medication. Even tiny amounts, just 10 micrograms daily, can mess with the stability of these life-saving drugs. Recent studies found that 60% of patients taking warfarin experienced dangerous drops in their international normalized ratio levels when they added just 20 micrograms of vitamin K2 daily. INR is how doctors measure whether your blood thinner is working. When INR drops below therapeutic range, your blood becomes more likely to clot, dramatically raising your risk of stroke, heart attack, or pulmonary embolism. What makes this particularly dangerous for seniors is that many people over 60 take blood thinners for atrial fibrillation, previous strokes, or other heart conditions. They're also dealing with bone loss and get attracted to vitamin K2's bone benefits. It seems perfect, but without careful medical supervision, it can be deadly. There's good news though. If you're on newer direct oral anticoagulants like apixaban or rivaroxaban, vitamin K2 is much less likely to interfere. These DOAC medications work differently and don't depend on vitamin K pathways. But you absolutely must check with your doctor before making any changes. Let's talk about something supplement makers don't want you knowing. Your kidneys change dramatically after 60, and this affects how your body handles magnesium in potentially dangerous ways. As we age, our glomerular filtration rate naturally declines. Doctors measure this as your estimated GFR, and it happens to almost everyone. What this means is that substances that used to be easily cleared from your blood, like excess magnesium, now tend to build up above the normal 1.7–2.2 mmol/dL range. Your kidneys eliminate almost all magnesium from your body. When kidney function declines even slightly, magnesium levels in your blood can rise significantly above 2.6 mg/dL. Research shows magnesium toxicity includes central nervous system depression, muscle paralysis, breathing problems, dangerously low blood pressure, and heart rhythm changes. There's a simple test doctors use to check for magnesium toxicity. They tap your knee to test your patellar reflex or deep tendon reflex testing. When this reflex disappears, it signals that magnesium levels have become dangerously high. But here's the problem. Most people taking magnesium supplements have never had this simple test done. If you have any degree of chronic kidney disease, and many people over 60 do without knowing it, you need to be especially careful. Research specifically warns that patients with kidney problems should have their magnesium doses modified and receive regular monitoring of blood magnesium levels. Now let's address something that's becoming increasingly common: vitamin D toxicity from well-meaning but dangerous high-dose supplementation. Many seniors take 5,000, 10,000, or even higher daily doses of vitamin D, often based on outdated advice or misunderstanding their 25-hydroxyvitamin D blood test results. Here's what research reveals. High doses of vitamin D can actually deplete your vitamin K2 levels, creating a dangerous imbalance that leads to vascular calcification. Vitamin D increases calcium absorption, but without enough vitamin K2, that calcium doesn't get properly sent to your bones. Instead, it ends up in your arteries, kidneys, and other soft tissues where it causes arterial calcification and serious damage. The studies are alarming. Frequent consumption of excessive vitamin D can lead to kidney damage, and most research shows moderate to severe kidney damage in people with vitamin D toxicity above 150 ng/ml on their 25-hydroxyvitamin D test. In one study of 62 people given excessively high vitamin D doses, all showed signs of kidney damage, regardless of whether they had healthy kidneys or pre-existing conditions. Vitamin D toxicity officially starts at blood levels exceeding 150 ng/ml on the 25-hydroxyvitamin D blood test. But damage can happen at lower levels if you're also deficient in vitamin K2 or magnesium. The irony is that people often start taking high doses of vitamin D to improve their health, but end up creating new problems. Here's something that might surprise you. Taking vitamin D can actually make you more magnesium deficient. This creates a cycle that many seniors fall into without realizing it. Your body needs magnesium to convert vitamin D into its active form. When you take vitamin D supplements, your body burns through more magnesium to process them. If you're already magnesium deficient, and 48% of Americans eat less than the recommended amount, taking vitamin D can make this deficiency worse. The signs of magnesium deficiency in seniors often get blamed on normal aging, muscle cramps, weakness, fatigue, irregular heartbeat, and trouble sleeping. But these could actually be symptoms of magnesium depletion caused by vitamin D supplementation. This is why combining D3, K2, and magnesium makes sense theoretically. Each nutrient supports the others. But the timing, dosing, and monitoring become crucial, especially as we age and our bodies become less resilient to imbalances. If you're like most people over 60, you're probably taking multiple medications. What you need to know is that magnesium supplements can interact with many common prescriptions in ways that could reduce their effectiveness or increase side effects. Magnesium can interfere with certain antibiotics, making them less effective when you need them most. It can boost the effects of blood pressure medications, potentially causing your pressure to drop too low. If you're taking diuretics, they can increase magnesium loss through your urine, while simultaneously taking magnesium supplements can interfere with how well the diuretics work. Proton pump inhibitors like omeprazole or Prilosec, which many seniors take for heartburn or GERD, can reduce magnesium absorption from food while also potentially interfering with magnesium supplement absorption. This creates a complex web of interactions that requires careful medical oversight. Despite all these warnings, I don't want you thinking this nutrient combination is inherently bad. When done correctly, under proper medical supervision, it can provide significant benefits for people over 60. Research shows that combined vitamin D3 and K2 supplementation significantly increases bone mineral density compared to taking either nutrient alone. For postmenopausal women with osteoporosis, this combination appears particularly useful for improving lumbar spine bone density as measured by DEXA scan testing. Magnesium supplementation in people over 65 has been shown to improve cognitive function by over 9%. Higher magnesium intake gets linked to lower risk of developing frailty, literally cutting the risk in half in some studies. It's also associated with better walking speed and overall physical function. From a heart health standpoint, the combination can be protective. Vitamin K2 helps prevent arterial calcification by activating matrix GLA protein and osteocalcin, while magnesium supports healthy blood pressure and heart rhythm. Vitamin D supports overall immune function and may reduce inflammation. If you're going to take this combination, here's how to do it safely. First, get baseline testing. You need to know your current 25-hydroxyvitamin D level, kidney function through estimated GFR, magnesium status, and if you're on blood thinners, your international normalized ratio levels. Start with conservative doses. For magnesium glycinate, begin with 200-300 mg daily with food. For vitamin D3, unless you're severely deficient, 1,000-2,000 IU daily is usually sufficient. For vitamin K2, aim for 90-120 micrograms daily, preferably the MK7 form of menaquinone. Take them with your largest meal of the day to improve absorption and reduce digestive upset. Magnesium glycinate gets chosen specifically because it's gentler on the stomach than other forms like magnesium oxide. Monitor your response carefully. Watch for any signs of magnesium excess, unusual fatigue, muscle weakness, changes in heart rhythm, or digestive issues. If you're on blood thinners, your doctor should monitor your INR more frequently when you start vitamin K2. Recheck your levels every 3 to 6 months initially, then annually once stable. Your 25-hydroxyvitamin D level should stay between 30-50 ng/ml as shown on screen. Higher isn't necessarily better and can be harmful. Your magnesium should stay in the 1.7 and 2.2 mg/dl range. Certain groups of seniors need to be especially cautious with this combination. If you have diabetes, your blood sugar medications might interact with magnesium. People with heart disease need to be careful because magnesium can affect heart rhythm and blood pressure. If you have any degree of chronic kidney disease, even mild, you need medical supervision before starting magnesium supplements. The same goes if you have a history of kidney stones, as vitamin D can increase calcium absorption and potentially contribute to stone formation. Those with intestinal diseases like Crohn's disease or ulcerative colitis may have altered absorption and should work closely with their healthcare providers to determine appropriate dosing. The combination of magnesium glycinate, vitamin D3, and vitamin K2 isn't inherently dangerous, but it's also not as simple as many supplement manufacturers make it seem. The interactions are real, the risks increase with age, and the consequences of getting it wrong can be serious. The key is working with a healthcare provider who understands these interactions and can monitor your response appropriately. Don't self-prescribe high doses based on internet advice or general recommendations. Your individual situation, your kidney function, medications, health conditions, and current nutrient levels all matter enormously. Remember, they're called supplements for a reason. They're meant to supplement, not replace, a healthy diet and proper medical care. As we age, our bodies become less forgiving of imbalances and more susceptible to interactions. What worked in your 40s or 50s might not be appropriate in your 60s and beyond. If you're currently taking this combination without medical supervision, don't panic and stop everything immediately. Instead, schedule an appointment with your healthcare provider to review your supplement routine. Bring the actual bottles so they can see exactly what you're taking and in what doses. The goal isn't to avoid beneficial nutrients, but to use them wisely and safely. With proper guidance and monitoring, many seniors can benefit from this combination while avoiding the potential pitfalls. Your health is too precious to leave to chance, and these nutrients are too powerful to take casually.